Good afternoon, everyone, and welcome to my Friday message. One of the highlights of our academic calendar is commencement. Duke's commencement ceremonies not only include the undergrads, but many of our School of Medicine, biomedical, and health professions programs. And we'll have a number of events and participate in the university ceremonies this next week, May 6th to 8th. Some of our programs are not synchronized with this timing and will have ceremonies at other times of the year. Nevertheless, for all, it's a time of celebration. Our students who have persevered in a time of immense challenge, for their families who've provided support in so many ways as they pursue their dreams, and for our faculty and staff who have invested their knowledge, time, effort, and passion in the success of our students. Some of the details of the formal scheduled events for the School of Medicine include the University Commencement Ceremony, which will be held in Wallace Wade Stadium on Sunday at 9 a.m., our MD program, which will hold its Hippocratic Oath ceremony on Friday, May 6th at 7 p.m. in the chapel. The Doctor of Physical Therapy program, which will hold graduation at the Washington Duke Inn on Saturday, May 7th. The hooding ceremony for our biomedical PhD students hosted by the grad school would take place May 7th. And on Saturday, May 7th, our Masters of Biostatistics program will recognize and celebrate 46 graduates in a private ceremony at the University Club. And finally, our master's program of biomedical sciences students will be recognized in a ceremony also on Saturday, May 7th. On behalf of the School of Medicine, faculty, staff, and fellow students, I want to send our heartfelt congratulations to all of our graduates for their outstanding accomplishments and wish them all the very best in the next phase of their lives and careers. And I want to thank our faculty and staff for supporting you. I am so proud of our education programs and the impact our graduates in their professions will have as they pursue them. Now, some updates about COVID. New data released from North Carolina show that an uptick in cases, with more than 9,400 new corona cases reported last week, is up from 7,600 the week before, similar to many areas of the country. However, hospitalizations are down a bit, with 254 new weekly hospital admissions compared to 277 the previous week. Consistent with this data, we have seen a slight increase in COVID cases among our employees in the last week, but fortunately, no employees are hospitalized. And on campus, there are 93 active cases among students with 114 in isolation. So our local data are consistent with the rest of the country, with increased cases not associated with proportionate increase in hospitalizations, but we will continue to monitor the data. But data does continue to show that vaccination with boosters significantly reduces illness associated with infections, and this continues to hold up with Omicron. In a new study in the New England Journal published this week, researchers reported that a fourth dose of Pfizer vaccine was effective in reducing short-term risk of COVID-related outcomes for people who had received a third dose at least 4 months earlier. Researchers found that 14 to 30 days after receipt of the fourth dose, vaccine effectiveness was estimated to be 52% against infection, 61% against symptomatic COVID-19, 72% against COVID-related hospitalizations, and 76% against COVID-related deaths. And an interesting weekly report released from the CDC also shed light on the lower rates of severe disease despite increasing cases. The CDC's National Commercial Laboratory Surveillance Study, which is a repeated cross-sectional national survey that estimates the population in the US that has infection-induced SARS-CoV-2 antibodies. The antibodies measured are to the nucleocapsid, which are not induced by the vaccine and therefore do indicate those have been naturally infected. The study period was September 2021 to February 2022, and as of the end of February, nearly 60% of adults and 75% of children had these infection-associated antibodies, with nearly a third of the children becoming positive since December, i.e. when the Omicron became the predominant strain. Much of the high positivity rate could be attributed to the Omicron surge, as only 34% of Americans had those antibodies prior to the study period. And the highest increase in this period were among children and the lowest among adults 65 and older, reflecting the relative vaccination of these populations. However, studies continue to demonstrate more predictable protection from severe infection with vaccination that includes boosters. And a reminder that Duke is now offering, but not requiring, a second booster shot or fourth dose of the Pfizer vaccine for eligible faculty, staff, and students, over the age of 50, as well as anyone who is considered severely immunocompromised. For more information or to schedule an appointment, visit the Duke COVID website or seek vaccinations at local pharmacies or through your healthcare provider. Lastly, this week on Tuesday, the FDA said that it needed more data to approve COVID vaccination for children under 5, the only age group still not eligible. This was followed by an announcement yesterday from Moderna that it had the efficacy and safety data for a 25 microgram dose and would seek EUA for the vaccine of our youngest children from 6 months to 5 years. Moderna has also requested authorization of its vaccine for 6 to 11-year-olds and 12 to 17-year-olds. Pfizer hasn't submitted an application for its vaccine for children under 5 yet, but is expected to soon. This is all good news in hopes of getting an approved vaccine for our under 5 age group, possibly by June. And let me end with some great School of Medicine news. 4 PhD students in the School of Medicine recently received prestigious awards from the National Science Foundation's Graduate Research Fellowship Program for 2022. These fellowships fund outstanding graduate students pursuing PhDs or research master's degrees in NSF-supported science, technology, math, and engineering. Congratulations to these 4 outstanding students. And congratulations to Drs. Rashid Gabatajisan and Patty Lee, both recently elected to the Association of American Physicians, an honorary society for physician scientists, a well-deserved recognition for both. Thanks to everyone for all that you do, and have a great spring weekend.